Hi, I'm Randy Golden with Medical Technologies of Georgia, and I'm here today to introduce you to MTG Kiddie-Kath, the first closed-system pediatric intermittent catheter that's designed specifically for kids. Actually, we hope that your kids will become more compliant with their catheterizations after they see how easy Kiddie-Kath is to use. Kiddie-Kath is actually designed to be used by kids with all the components in a nice small package that is really easy to work with. First of all, everything in the kit is latex-free. We have latex-free cuffed folded gloves. I'm just going to set everything out here so everybody can see it. There's an underpad in here, which in case there's any spillage, there shouldn't be much, but if there is, we have this underpad which will collect some of that drippage should there be a drop or two. There's an antiseptic BZK wipe in here. This is clear. It won't create a big mess like the iodine products will. There's a gauze tissue to clean up afterwards. And then this is the catheter. This is our 8 French Kiddie-Kath. We do make this product in 10 French as well. We call it Easy Advancer. And Kiddie-Kath is a 700 milliliter collection bag with a catheter that's inside the bag. And the bag does two things. It protects the sterility of the catheter, and it's also going to catch the fluid once the urine starts to flow. And what the child will do is they'll take the cap off, expose the introducer tip below, and then the catheter will be fed through this introducer tip. I'll explain that in just a second, about 1 to 2 inches at a time. And as you advance it forward, it locks into place because we have our Easy Advancer locking valve, which keeps that catheter from going backwards. So the child will never touch the catheter and just advance it about 1 to 2 inches at a time, just like I'm doing it here. And I'll show with the model in just a second how this is going to work. At some point, the urine's going to flow. It's going to get trapped right in the sac. Okay, we're just going to take the whole thing out, tear the bag, pour the urine off, and when we're finished, we have a privacy bag. Just assume that I went ahead and drained the fluid off. The privacy bag's also really nice because, as y'all know, kids are very private and don't want other kids to find out about their catheterization. So you can literally put all the refuse in here once you're finished and toss this out and not have to worry about having your friends see the catheter at the top of the trash can. MTG's catheter eyelets or drainage holes are fire polished, so they're less likely to cause irritation as the catheter winds its way through the urethra. We also have a conical tip which helps the catheter pass through tight spots along the way. Before I show the demonstration with the model, I just want to talk briefly about the introducer tip and how integral and how important this introducer tip is. The introducer tip, which is made from silicone, I'll pull it off and show everybody, is designed to reduce the risk of contamination of the catheter within the distal urethra. And I'll put it back on and show everybody how this is going to work. The introducer tip is going to go in along with the catheter, and most bacteria, right when you first go in the first about ½ inch of the distal urethra, in men, women, boys, and girls, it's all the same. And if that catheter comes in contact with those bacteria, it can push the bacteria further into the body. They can grow back and cause urinary tract infections, and there's all kinds of studies that prove that. With the introducer tip, the catheter remains protected from those bacteria, so we're not pushing those bacteria back into the bladder. And now I'd like to explain to everyone how to use Kiddie-Kath with your children. First, I'm going to demonstrate this product with a girl, with a female anatomical model. If you have a son, please check out our Easy Advancer video on the website, which talks about catheterization of males. First thing I'm going to do is I'm going to take the cap off of the introducer tip and expose the introducer tip below. I'm going to set this aside for the time being, and I'm going to spread the labia with my left hand. I'm right-handed, so I'm going to use my left hand to spread the labia, and I'm going to do everything else with my right hand. I'm going to take the BZK wipe, which is our antiseptic prep, wipe downward over the urethral opening one time, and then set that aside and discard it. I'm going to hold the catheter in my right hand, and I'm going to insert the catheter and the introducer tip in the urethra, just like this. Give it a couple of pushes. 1 push, 2 pushes, and we go. Okay, once we see urine begin to flow, give the catheter 1 more push to get it right in the middle of the bladder, and keep the bag parallel with the legs. We want to make sure that the logo is up and that the urine flows directly into the sac. You don't want to hold it upside down or the urine can come back on your daughter. Once urine finishes flowing, pull the catheter out about 1 inch and see if we get any more fluid. When she's completely finished, go back and get our gauze tissue, there she is, and take the catheter out of the body. And when the catheter leaves the body, use the gauze tissue to collect the eyelet so you don't have any spillage. Measure and record output. When we're finished, extend the catheter all the way to the top of the bag. Take one hand and entwine the catheter just like this with the gauze tissue, and just pull the catheter out the top, and there's our sterile sample port. You can also pour the urine off from here as well. When we're finished, as I mentioned earlier, use the privacy bag for the refuse so that we don't have any catheters on top of our trash can at school. So, if your child is looking for a product that's going to give them more privacy, or you're looking for something that's going to reduce the risk of infection, the great news is Kiddie-Kath gives you both. To request samples, please visit medtechga.com and we'll send samples right away.